Assalamu alaikum and welcome to our fourth and final webinar in our Mental Health Awareness Month series. My name is Dr. Syed, and again, I am from the Khalil Center. This is a collaboration between the Khalil Center and ISNA, the Islamic Society of North America, to help bring more awareness to mental health issues, to help lessen the stigma of mental health concerns, and inshallah, just to help educate the community better about what are mental health problems. So today's webinar is titled, What is Therapy and How Can It Help Us? I'm going to start out talking a little bit about why it is important that we even discuss therapy. Why is this something that we need to know about, and why is this something that impacts us? So roughly 20 million people in the United States suffer from depression every year. Women are 2 times as likely to suffer from depression than men are. Now, the reasons for this are multiple. The most commonly understood reason, in my understanding, is that because women are also more likely to report depression, and also depression tends to look different in women than it does in men. Usually when we think of depression, we're thinking of sadness, crying, looking emotional, looking down. A lot of times men experience depression as being irritable, as being angry, and it doesn't always get identified as such. So right now we still consider the numbers that women are twice as likely, but personally I do believe men suffer depression just as much, but it's either underreported or it's not recognized as depression. Surpassing even depression, anxiety is the most common form of mental illness in the United States. It's estimated that approximately 10% of teenagers and 40% of adults suffer from an anxiety disorder of some kind. That's a huge number. Almost half of the adults in the United States suffer from some sort of anxiety disorder. That is not exclusive only to, for example, Caucasian community or to a specific faith community. That's across the United States. And in our work at the Khalil Center, I can certainly attest to the fact that anxiety is very common in Muslims, is very common in different ethnic backgrounds, and it's not something that skips over anybody. Statistically, again, women are more commonly affected by anxiety disorders than men. So in our communities, unfortunately, we sometimes get what I like to call quote unquote helpful advice. Most of us are much more comfortable dealing with issues of physical illness versus mental illness. So this is a little comic that I wanted to add in this. It's funny, but it's not funny at the same time because unfortunately this is very true for people. This is if we treated physical illnesses the same way we treat mental illness. So the top left picture, you see somebody, looks like they have a thermometer in their mouth, they're shaking with chills, and the friend is saying, I get that you have food poisoning at all, but you have to at least make an effort. We know that when someone has food poisoning, we don't expect them to try to get out of bed or make an effort. But when someone has depression, that's exactly what we try to expect from them. Top right, you see somebody, it looks like their hand has been cut off, there's blood pouring out of the wound, and the friend is saying, you just need to change your frame of mind, then you'll feel better. Bottom left, there's somebody throwing up, clutching a toilet seat, and the friend is saying, have you tried, not having the flu? I've had people say, have you tried, not having anxiety? It's just not that easy. And if it was that easy, people wouldn't have mental illness. Bottom right, you see someone, it looks like they're giving themselves a insulin injection into their stomach, so they're probably diabetic. And we know that if someone is diabetic, their medication is not optional. Their medication isn't if they feel like it, if they don't feel like it. It's something that they have to take that is part of them being healthy in their life. And the friend is saying, I don't think it's healthy that you have to take medication every day just to feel normal. Don't you worry, it's changing you from who you really are. We'll talk more about medication as we get further in the webinar today, but that is definitely an issue when people already have such a hard time preparing themselves mentally for the idea of taking medication, but they can't get support from their family or friends, or they feel like something about the medication is going to change who they are. And unfortunately, that is part of what the goal is. When you take a psychiatric medication, you do want it to change because who you are right now is somebody with depression or somebody with a severe anxiety disorder. That's exactly what you're trying to do. In any case, let's go on to the next couple. Here we see on the left some more helpful advice. Somebody has a stab wound, it looks like, and they're trying to hold the blood in. The blood is still pouring out, and their friend is saying, it's like you're not even trying. It's not always that easy. With mental illness, it's not always that easy to just try and make things feel better for yourself. And on the right, the final picture, looks like somebody's on life support. They've got an IV bag, and they're on a heart monitor, and the friend is saying, well, lying in bed obviously isn't helping you. You need to try something else. Once again, if it was that simple, if it was just about not laying in bed, if it was just about getting up and being active is going to get rid of your mental illness, people would do it. We don't do it because it's much more than that. Treatments for mental illness, as I just mentioned, there are medications. These are drugs used to reduce the symptoms of anxiety disorders, including antidepressants and anxiety-reducing drugs. There are many other types of medications as well. We also have antipsychotic medications for people with much more severe mental illnesses and different kind of situations. What I do, and what all of us here at Khalil Center, all the clinicians here do, is what we call psychotherapy. Psychotherapy addresses the emotional response to mental illness. It's a process in which trained mental health professionals help people by talking through strategies for understanding and dealing with their disorder. This is what we also refer to as talk therapy. Psychotherapists alone do not prescribe medication. Medication has to be prescribed by a physician. So your psychiatrist, your family physician, your PCP, someone has to prescribe the medication. Psychotherapy is done with a psychologist or a master's level therapist, and they address your emotional responses to the illness, not the physical or what we call medical responses that medication can deal with. Dietary and lifestyle changes absolutely are part of treatments for mental illness. Sometimes people are very surprised to learn how much dietary and lifestyle changes can help. And that includes things like relaxation therapy and exercise. Physical exercise, getting 30 to 40 minutes of exercise around 3 to 4 times a week can be a tremendous help in reducing symptoms of depression and helping with anxiety and just all around helping with stress. Long-term chronic stress is also something that impacts people who have mental illness. So anything that can help that is going to be beneficial for you. Relaxation therapy is things like breathing exercises, taking time to just be away from your normal stressors. And sometimes it can be as small as 5-10 minutes. It can be as long as, an hour or two. It doesn't have to be paying for an expensive massage at a nice spa, although that is certainly going to be very relaxing. But this can be anything what we call like imagining yourself being someplace else, visual imaging. Sometimes we'll talk people through the experience of being someplace very relaxing, being someplace they remember what it was like to feel relaxed and feel safe and feel like they weren't stressed out. There's a lot of different types of relaxation therapies, and any therapist can help you understand that better and learn how to do it. So back to talk therapy, because that is what today's webinar is pretty much about. Who does it? Well, like I said, a psychologist can do it. That is a doctorate level designation. So a psychologist is someone who has their doctorate degree, graduate degree in psychology. A therapist is a master's level position who also has a degree in psychology. A counselor or a social worker, both of those are also master's level if they're doing therapy with you. What kind of therapies are there? So you hear this a lot, I feel like, in pop culture, the idea of CBT, cognitive behavioral therapy. It is certainly one of the most popular types of therapy. It is not the only kind. Cognitive behavioral therapy is highly researched, and we know that it can be extremely effective for specific conditions such as depression. Actually, CBT is probably the most effective known therapy for depression. It is very goal-oriented. You have a plan and you take steps to alter the thoughts and behaviors that are leading you to have negative thoughts and negative affect causing depression. Dialectical behavior therapy is a similar offshoot of CBT. Family systems, which is the idea that it doesn't necessarily have to be blood family, but all of us reside with some people around us that are part of our system, whether it's our roommate, coworkers, it could be your friends, it could be your significant other, whoever your quote unquote family is. And the idea of how do they fit into your system and what role do they play. Person-centered or Rogerian therapy looks at the individual as being the expert, not only in their condition, but also the expert in you. You know what's best for you, so you kind of take the lead there. The therapist is there to facilitate understanding and provide unconditional positive regard. What we oftentimes traditionally think of as therapy is what is actually known as psychoanalysis. This is kind of like what you might see in movies sometimes, the picture of somebody laying on a couch and the therapist sitting behind them and just jotting notes, maybe smoking a cigar like Sigmund Freud. It is certainly a valid form of therapy. It is not as commonly used as it used to be at one time. Psychoanalysis also tends to be long-term therapy, so not necessarily what is right for everyone, but it is certainly something that is very beneficial for somebody who is seeking out a clinician trained in psychoanalysis who knows what they're doing. And it can be extremely helpful. Therapy can look different depending on who is in the room with you. We do therapy with individuals, with couples, and with families. We can also do therapy in a group, what's called group therapy. It's a very different dynamic from individual one-on-one therapy. Also, we can do therapy with children, adolescents, and adults. People have asked, how young someone can start therapy. The youngest I've personally ever worked with was 4 years old, but I do know clinicians who work with children as young as even 2 years old, 18 months, I've also heard. So with children that young, we are not doing talk therapy because, of course, it's not going to be effective and they're not going to be able to participate the same way an adult would be able to. It's much more likely that we're going to be doing specialized play therapy. Clinicians who work with children, especially young children, have specific training in play therapy, which includes artwork, which can include with actual toys or games. It can include, drawing, painting, and often work with sand trays. And we kind of use those different aspects to help determine how the child is progressing and how they're doing. It looks very, very different from traditional adult therapy that is talk therapy. Psychoeducational psychotherapy is what almost looks like classes. So for example, parenting classes, anger management classes, even sometimes understanding mood disorders. This can be very helpful for somebody who has just been diagnosed for the first time and doesn't know much about it. It can also be very helpful for friends and family members. So for example, if you have a teenager who just got diagnosed with an anxiety disorder, or if your spouse has been diagnosed with major depressive disorder, going to a psychoed-based mood disorder group can help you understand more about it in a way that is non-judgmental, being done by somebody who is an expert in the field. And the other people in the group are all people in the same situation you are. They also are dealing with, a friend, a family member, loved one who is dealing with a mood disorder, or they themselves are newly diagnosed with a mood disorder. So it's a much different atmosphere than just, for example, taking a class at a community college, learning about psychology. You're going to learn about it in a different way. You're going to understand about it in a different way. Parenting and anger management, sometimes these can be court-ordered or mandated. Sometimes people, mashallah, speak up and ask for them on their own. In either case, again, you are getting the training from someone who is skilled and an expert in the field, someone who has worked with other people who've been in similar situations. And likely, if it's a class, you're taking it with other people in the same situation as you. The average length of therapy, not necessarily for the psychoed classes, but for individual or couples, family kind of psychotherapy, is 12 to 16 weeks. The average therapy hour is 50 minutes. It's not actually a full 60 minutes, although it is called an hour. It's 50 minutes long. And usually they are weekly sessions, which means you have to come in once a week for 50 minutes, about 12 to 16 weeks. None of this is in stone. That means that it's up to you and your therapist to decide what is best for you. Some people attend much longer, some people attend much shorter. Everybody is different and every situation is different. depending on what is best for you, depending on your specific needs, and also sometimes depending on your circumstances. You may not be in a situation where you can come every week. Perhaps your insurance only covers part of it and you have to pay for some of it. Then you might not be able to come for 16 weeks. So we take all of that into consideration and do our best to meet you where you are at. What does a therapy room look like? This is a picture of my own office. People have often asked, what does it actually look like? Because I think that's a part of what is many people's apprehension about therapy, is they don't know what to expect. We all know what a doctor's office looks like. We all have an idea what a dentist office looks like. But most people coming to therapy for the first time have no idea what to expect for a therapist office to look like. Yes, I do have a couch that the clients can sit on. Opposite the couch is my chair that I sit on. You are not at all required to lay down or anything like that. I just ask that you be comfortable. Most of my clients absolutely sit up. The only time I've ever had someone lay down is if they were not feeling well or particularly tired that day. Very, very rare. So usually people sit up, people sit as they are comfortable. I try to make it a relaxing place for people. I try to use, colors that are cheerful. My blues and yellows here. I've got some artwork up that isn't necessarily seen in this picture, unfortunately, but we try to make it an inviting environment, some place that somebody can look forward to being at and not feel, like they're being under a microscope or not feel uncomfortable or anything like that. So now you're here, you're comfortable in the room, you're sitting on the couch. What's next? What do we actually do in a session? Well, your first session is what we call an intake. An intake is not a counseling session. No therapy is going to happen necessarily. The purpose of an intake is to find out what's going on. We want to get to know what's going on and what you want to work on. What that means is sometimes it may seem like, okay, this is someone who's, for example, struggling with an addiction or someone who is struggling with their relationship. The obvious thing, of course, would be to work on the relationship or work on the addiction. That might not be what you want to work on. We need to make sure that we, the therapists, understand what's going on for you and where you're at. So that's the purpose of an intake. We discuss goals for therapy, what we would like to see. So for example, if I think this is something you should work on and you think you have something else, how can we kind of blend those together while still being within your comfort zone and being respectful of your decision to decide what you want to work on? We would talk about possibly homework or journaling that would be required of you in therapy. These are all things that different clinicians use, but we would never impose on you. Meaning if you're someone who is absolutely opposed to journaling and you're not willing to try it, that doesn't mean you have to give up therapy. That just means we have to come up with something else that could hopefully suffice the need that we had for journaling, but do it in a way that helps you out without having to actually do that. So for example, we'd have to be a little bit more creative and come up with something else. Therapists are never supposed to make you do things necessarily that you're not comfortable doing. You have every right to speak up and say, this isn't going to work for me, or I tried this and I didn't like it. The purpose of therapy is to help you. So if you're feeling bullied, if you're feeling like you're being forced to do stuff, you're not going to get anything out of therapy, which defeats the purpose. We really do want you to be comfortable. We really want you to get the most you can out of this experience. Like I said earlier, relaxation exercises are also going to be part of most therapy experiences. The example I put here is squared breathing. It's a specific breathing technique that I usually do in intake sessions with most of my clients. The exception would be if we had a lot to go over and we didn't get a chance to get to it, then I might do that in the first session. Squared breathing is a specific breathing exercise where we learn to breathe slowly, slow down our breathing, inhale with our nose for 5 seconds, hold our breath for 5 seconds, exhale for 5 seconds, and then be still for 5 seconds. While we do this, we draw a square in our mind, one line of the square for each of the 5 seconds. And what it does is slow down your heart rate, slow down your breathing. It doesn't get rid of your stress. It doesn't take away your problems. But when you're relaxed and your heart rate is slower, you are more in charge of your situation. You're more in charge of your emotions. It's easier for you to manage the stressor. So what can you expect in a session? Of course, that all information is kept confidential and by law is protected by HIPAA, which means that we would need your signed consent to release any information to anyone else. That means even the fact that you are in session. So for example, sometimes this happens with our young adult clients. If I have someone, let's say there's 25 years old, and their mom calls in and says, my daughter forgot her lunch. I know she's on her way to her therapy session. Can you tell her to call me? The problem is I can't confirm or deny that she's my client. I literally cannot say, sure, she'll be here soon, I'll give it to her. Because I have to have signed permission from the client that I can tell her mom anything. And if I don't have that, I literally can't even tell the mom that little bit of information. I can't share anything. If the person is under 18 and their parents have to be part of the intake, meaning they have to sign permission letting us speak to them, then we can give some kind of information. Usually clients over somewhere between 12 and 14, we talk to the parents about if they're comfortable to let us decide how much information we share. And usually we would tell the parents anything specific that we think the child might be in danger or might be at risk for any harm. But otherwise, we would just let them know if we're making progress or if we're having any issues, and we would keep the specifics out of those conversations. And the reason, of course, is because we want the information and we want the session to feel non-judgmental and unbiased. We don't want someone to feel that anything they tell us is at risk of going back to their parents or their spouse or family members or anything else. Also, being a Muslim counseling center, sometimes the community can feel really small, and you run into people, and you may see one of us at the grocery store, at the masjid, or even at a dinner party. We want you to feel as comfortable as possible knowing that we take your confidential information very seriously. We respect your privacy above all else, meaning we won't say hello to you outside of here unless you say salam to us first. And the reason is because we don't ever want to risk someone asking, well, how do you know Dr. Sarah? How did you meet her? And then you being put on the spot and having to explain that I might be your therapist. So if you're comfortable to say salam to me, I'll absolutely say salam back to you, but I'll never initiate it. And like I said, all of your information here is kept perfectly confidential. You have to sign, even if you're the one who wants us to release it. Let's say a year later you want to have your records sent to another therapist, that's absolutely fine. You have to come in and sign a release giving us permission to do so. Even just asking us to do it over phone or email is not adequate to meet the laws of HIPAA. You have to come in and sign it. That way we have permission to send it wherever you need it to go. Of course, we want this to be a safe space. We want this to be a place where you don't feel judged or feel that we are not treating you fairly or anything like that. So if you ever feel something like that in session, you have to let your therapist know. You have to let them know that something feels off or you're not fully comfortable. A lot of times people have trouble with this one. I've had clients tell me that they didn't want to hurt my feelings, or they felt rude by telling me that they felt like something was wrong or there was a problem. The issue is that the purpose of therapy is to help you. If my feelings get hurt, that's my problem, and I'll take care of it. But I can pretty much promise you my feelings are not going to get hurt. If you're stepping up and asking me to take notice of something that isn't going the way you need it to go, that's showing progress. That's excellent. I'll be happy to hear something like that, and so will most therapists. So you gotta, inshallah, please feel free to feel safe to let someone know if there's any issues and if anything doesn't feel comfortable to you. Again, the goal and purpose of therapy is to help you, get over whatever issue that you're here trying to overcome. And that's not gonna happen if you're feeling anxious about it. So a little bit back to anxiety. I wanted to specifically talk about depression and anxiety because these are the most common things that we see in therapy. People come to therapists for broad variety of reasons. It is not just for depression and anxiety. Personally, I have most of my work with couples, so I do a lot of marital therapy, which doesn't necessarily even involve depression or anxiety. Although most of the time, one or both elements has become part of the relationship by the time someone comes to see me, unfortunately. But generally, just to understand a little bit about anxiety, variations can include generalized anxiety disorder, GAD, social anxiety, panic disorder, post-traumatic stress disorder, which we call PTSD, agoraphobia, fear of being in crowds or fear of being out in public places, specific phobias like fear of dogs or fear of spiders, and obsessive compulsive disorder, OCD. Actually, in the newest DSM, the Diagnostic and Statistical Manual that we use to diagnose disorders, OCD has now become its own category because it's so nuanced, even past just anxiety. Anxiety affects the sufferer physically as well as mentally. So there's a lot of physical symptoms that we have to address sometimes in therapy. That can include things like panic attacks, shortness of breath, shaking, nausea, headache, rapid heartbeat, like what we call palpitations, even dizzy spells and more. Sometimes people are very surprised to hear this because they experience these things and they've been talking to their general doctor about it. And most of the time, if they're in my office, it's because the general doctor couldn't find any cause or reason for any of these things. And that's how we kind of have to narrow it down and realize that it's not a physical medical illness. It's probably something more mental illness related. When we talk about phobias, just quickly, rather than being simple fears, these are seriously debilitating, intense feelings of panic that cause sufferers to go to great lengths to avoid encountering subjects of their phobia, such as heights or tightly enclosed spaces. So, for example, we might throw out, the word phobia, saying, oh, she's got a phobia of elevators, she hates being in them, she keeps her eyes shut the whole time. Okay, the person may not like them, but if she's able to get in and keep her eyes shut and get through it, that's not exactly what we're talking about. We're talking about somebody who is willing to climb 11 flights of stairs and make themselves literally sick and take an hour to get up there because they would rather do that than get in an elevator. That is much more serious. Those who suffer from anxiety are prone to suffering from depression simultaneously. These two, unfortunately, very often go hand in hand. Anxiety disorders can be triggered by extended environmental stress or traumatic life events, but anyone can be afflicted with this form of mental illness. You don't need to have gone through a traumatic life event or even a specific environmental stress to get anxiety. War veterans are not the only ones who suffer from PTSD. It was originally a disorder that we used to classify the experience of vets returning from active combat duty. However, now we know that others who commonly experience post-traumatic anxiety, including flashbacks, are also survivors of sexual assault, domestic violence, child abuse, accidents, or natural disasters. After Hurricane Katrina, we unfortunately saw a lot of PTSD from survivors with their experiences of having to either flee the city or what it was like while they were stuck there and waiting for help. So we know that it's not just somebody who was in some kind of assault or attack or even war that experiences PTSD. What does anxiety look like? Feelings of panic, fear, uneasiness, problems sleeping. This can be either not being able to sleep or having what we call disturbed sleep, meaning like they're not able to sleep well, they're awake often, they can't sleep for hours at a time the way an adult should be able to. Cold or sweaty hands or feet, shortness of breath, heart palpitations, an inability to be still and calm, meaning someone who fidgets a lot, dry mouth, numbness or tingling in the hands or feet, nausea or other gastrointestinal, what we call GI issues. So that could also mean diarrhea, it could be constipation, it could be constant stomach aches, muscle tension, which can lead to headaches, teeth grinding, or back pain, and dizziness. So anxiety is not necessarily just mental. It absolutely can look physical, but treating any one of these physical ailments alone is not going to get rid of the anxiety. It does need to be treated also on the mental illness level. Can anxiety be prevented? Well, not necessarily. We don't think that can be prevented. However, there are things you can do to control or lessen symptoms. Nobody chooses to have anxiety. Nobody wants to have anxiety. However, we can try to do things to manage the symptoms. Some, what I would consider easier steps would be things like stopping or reducing caffeine products such as coffee, tea, soda, energy drinks, and even chocolate has some caffeine in it, though definitely not anything close to energy drinks or coffee. Caffeine is a stimulant. Somebody with anxiety is already stimulated. So when you give them caffeine, they're going to be more stimulated, meaning their anxiety is likely going to be worse. Ask your doctor or pharmacist before taking any over-the-counter medicine or herbal remedies. Many contain chemicals that can increase anxiety symptoms. Seek counseling and support if you start to feel regularly anxious with no apparent cause. Make sure you talk to someone. Practice self-care, like things we talked about earlier, regular exercise, doing things you enjoy. Unfortunately, in the United States, a lot of times people consider activities they enjoy as rewards. If I finish all my work, if I'm caught up on all my household chores, if everything else is taken care of, then I will sit down to read my book. Then I will go take a walk. Then I will have a nice bath. The problem is these things really are not meant to be rewards. To live a healthy life, these are things that have to be part of your routine. That does not mean you leave all of your chores behind or your work responsibilities and go take a 3-hour bath. That is not what I'm saying. But I am saying that having regularly scheduled self-care activities will make you more likely to complete your other tasks on time, have you be in a better mood, have you be less irritable, and increase your motivation. Taking regular breaks and taking care of yourself has never been shown to make people less productive. The reverse is actually true, and inshallah, you are often more productive. 1 in 4 young adults will suffer an episode of depression before age 24. So 1 in 4. People who are depressed are more prone to illnesses like colds than non-depressed people. We know that your immunity is affected when you have chronic depression. So colds, coughs, flu-like symptoms, things like that. It's not that you're going to get them more necessarily, but they're going to often drag longer. There are interrelationships between depression and physical health. So for example, cardiovascular disease and thyroid disease can lead to depression, but also those illnesses can cause depression and vice versa. Depression can also cause some of those cardiovascular diseases and thyroid issues. Over 8% of adolescents in the United States suffer from depression at a given time. 1 in 4 young adults, that's about 25%. 8% of adolescents, that's a pretty big number. Again, depression is physical, it's not just mental. So this is a good PET scan image that I liked, where the left side of the brain is a healthy brain, and the right side is a brain with depression. Not to imply that someone with depression is unhealthy necessarily, but you can clearly see different parts of the brain. Oh, excuse me, I actually said this backward. The right side is a healthy brain, and the left side with less of the yellow is the brain with depression. Much harder to be motivated, much harder to get yourself to do things you need to do. It's little things that seem little to other people, seem big to you. Disappointments that other people seem to be able to get over take you weeks or even months to get over. That's what depression feels like. Depression causes distress if unable to shake it off. Symptoms can even cause exhaustion. Stress is tiring. Stress can literally be exhausting. Mild depression requires time to rest, relax, change to a good, healthy diet, and restore life to continue to function normally. That's not saying that you have to eat a salad every day. That's saying a good, healthy diet. A good diet is something that includes all your food groups. You're getting fresh fruits and vegetables. You're not eating just a lot of fried foods or just sweet things. You're having a balanced diet. That's what's most important. Severe depression needs proper clinical treatment accompanied by overhaul and complete change of activities. Change of activities, mentally overhauling your cognitions, that's kind of what we were talking about earlier with CBT. The idea that we have to learn to change you have to learn how to change your cognitions and change your behaviors in order to overcome severe depression. Chronically depressed person lives in a clouded bubble, disconnected from reality. It's hard to even connect to the people you love and care about around you. It's hard to for things to feel like they matter to you. This often makes the depression feel even worse. I liked this image because, again, we sometimes think of depression as just being sad, and as you can see here, that's definitely not true. The emotional aspects of depression can be sadness or anxiety. They can also be guilt, anger, mood swings, feeling helpless or feeling hopeless, being irritable. There are behavioral changes such as crying, withdrawing from others, neglecting your responsibilities, changes in personal appearance. Often people with depression have a hard time maintaining hygiene, so they may not be showering as much as they should be. They may not necessarily have on clean, ironed clothes or have their hair brushed or makeup on or stuff like that. They may literally be moving more slowly, being agitated or unable to settle. The thoughts of somebody with depression are frequent self-criticism, impaired memory and concentration, indecisiveness, confusion, unfortunately, thoughts of death and suicide. Physically, somebody with depression has chronic fatigue. They're always lacking energy. They tend to either sleep too much or too little. We sometimes see people laying in bed but not sleeping for hours or even days at a time. And unfortunately, we often see the reverse, which is people sleeping much more than 8, 12, 15, 16 hours a day, 20 hours a day. Weight gain or weight loss, loss of motivation, substance abuse, unexplained aches and pains. Substance abuse often stems from people trying to self-medicate, help themselves feel better through illicit substances. There's a difference between being depressed and being down. Avoiding people, activities, work, self-isolating, like I said, poor hygiene and lack of concern about the hygiene, feeling exhaustion and constantly sleeping, weight gain despite poor or no appetite, and these symptoms lasting more than 2 weeks is being depressed. Having any one of these for a day or two is not being depressed. That's being down, which is absolutely normal, and everyone is down sometimes. There's nothing wrong with that necessarily. We all have times where we suffer disappointment, we suffer loss, we're going through grief. But when these symptoms are happening constantly, most of the day, and they're constantly lasting in a row, most days for at least 2 weeks in a row, then we've crossed into depression. There are a lot of different resources for help if you have a concern for yourself or someone else. The first step can be to offer support, talk to them, visit with them, take a dish of food, offer to watch their kids or help with their chores. If it's someone that you're comfortable with, maybe you can watch their kids while they visit a therapist, or even offer to go with them to a therapist appointment. Make sure that you're careful to guard anyone's trust when they tell you something as personal as experiencing mental illness. As Muslims, we know that when someone tells us something like that, it's an amana. It's a trust from Allah subhanahu wa ta'ala that you need to hold on to and guard very seriously. In our Islamic tradition, we know the concept of ziyara al-marid, visiting the sick. The Prophet ﷺ said, on the day of resurrection, God the mighty and majestic will say, O child of Adam, I became sick and you did not visit me. And the person will say, O Lord, how can I visit you? You are the Lord of all that exists. And God will say, did you not know that my slave so-and-so became sick and you didn't visit him? Did you not know that if you visited him, you would have found me with him? The idea that visiting the ill is a duty of Muslims, and mental illness is also an illness. Visiting the ill today revives the sunnah of our beloved Prophet ﷺ, as it illustrates the empathy that Muslims are required to feel for each other. This is not something you do if it's convenient. This is one of the things that we really need to take time to do. God's messenger also said, a visitor walking to visit a sick person will be waiting in the mercy of God. When the visitor sits with the sick one, they will be immersed in mercy until his or her return. I really wanted to make this point because, alhamdulillah, I've noticed that our community, mashallah, is very good when it comes to visiting somebody who has a physical illness, visiting somebody who just, even if they're having depression because of a death in their family, we are comfortable with those things. We know what to say. We know what to do. We know to take food. I've seen communities, mashallah, where whole neighborhoods are giving so much food that people have to freeze it and keep it. But when it comes to mental illness, when it comes to somebody who can't get out of bed or can't stop crying, or someone who looks like they're not maintaining their hygiene, we get scared. We don't know what to do. We don't feel comfortable. We don't want to go visit. And if we do somehow have to see them, we don't know what to say. We don't know what to do. And unfortunately, the longer we stay away from situations like that, the harder it is to go back to it. Somebody with a mental illness also needs support. They also need help. They also need care and treatment. And sometimes that can be as little as sitting with someone, offering to help them out at home, or, like I said, offering to take care of some of their duties so that they can take the time to go to a therapy appointment or see a psychiatrist and get medication. Unfortunately, sometimes when people start new psychiatric medications, there can be sometimes a few days or even a few weeks of experiencing side effects that makes you physically ill: nausea, vomiting, trembling, stomach aches, things like that, even restlessness, fatigue, that can be exacerbated by medication before it starts to work and make things better. Unfortunately, that is a reality of some medications, not all. But that also means it makes it even harder for some people who have a lot of responsibilities at home or work to be able to step up and take those steps to get treatment, because they know that if I have to take a medicine that's going to make me nauseous for a few days, who's going to take care of my family, or who's going to take care of my things at work? By law in the United States, all employers have to provide not necessarily paid sick time, but all employers have to give you some time off if you're having an illness, and mental illness is included. But of course, it's much harder to tell somebody that you can't come to work because you're depressed than it is to say I can't come to work because I have the flu. And unfortunately, because of the stigma that we have, people don't get the support that they need. So talking about mental illness, trying to remove some of the stigma, these are all steps to not only improve individual health, but honestly, inshallah, improve the health of our community, make it easier for people to seek out the treatment that they need, and inshallah, support each other through this. We at the Khalil Center really have a mission to do as much as we can to not only remove the stigma, but to provide a safe space for people to feel comfortable, get the help that they need in an environment that feels to them meets their specific needs. We have offices in Chicago. We have 3 Chicago area offices. We have 3 offices in the Chicago area. Our main office is in Glen Ellen, Illinois, in the suburbs. We also have an office on the south side of Chicago and an office just north of the city in Lincolnwood, Illinois. Our newest office is actually located in Bay Area of California in Santa Clara. Khalil Center also offers web therapy, which is available across the United States. This is a program where we use a specific format that is HIPAA compliant. We don't, use our own web chat programs, but we actually use a web therapy program that we can try to give as much confidentiality as possible from our end. You have to be able to confirm that you've got privacy on your end, but we have clinicians who are trained and qualified to work with you online, and they meet with you over video chat and do the same concept of 50-minute sessions once a week and talk to you and try to offer counsel and therapeutic support over the internet. We are only able to bill your insurance if you're in Illinois or California. However, we can offer our sliding scale fee structure to anybody, and we have the ability to be able to bill you for this over web therapy. So KhalilCenter.com is our website. You can get more information about not only about web therapy, but also about all the different programs we offer, the different types of clinical programs we offer, such as therapy, but also the other programs we have for the community. Again, my name is Dr. Sarah Syed. My email is on here, Sarah Syed, SarahSyed, @KhalilCenter.com. And I can also be reached at 630-283-2935. Jazakallah khair for joining me today. I hope you learned something. I hope this was a good use of your time, inshallah. Please do visit KhalilCenter.com, get more information. Remember that illness is illness. And Allah subhanahu wa ta'ala afflicts us all differently. Everyone experiences different trials and tribulations in their life, but it is incumbent on us to seek cure. We are mandated to seek treatment when we are ill. And alhamdulillah, we have resources. It may not always be necessarily in your area, but if you seek out help and if you are willing to look for help, inshallah ta'ala, we at Khalil Center will do our very best to try to help you. So please let us know if you have any questions or comments. And again, thank you so much for joining me today. Assalamu alaikum.